Hello, my name is Simon Rasmussen from the Department of Gastrointestinal Surgery at Aalborg University Hospital in Denmark. On behalf of myself and my co-authors Christian Torp-Pedersen, Kåre Andersson Gotschalck and Ladefoged Rasmussen, I'm here to present the study entitled The Effect of Antithrombotic Treatment on the Fecal Immunochemical Test for Colorectal Cancer Screening, a nationwide cross-sectional study. On a global scale, colorectal cancer is the second leading cause of cancer-related death, and colorectal cancer screening has proved efficient at both decreasing the incidence and mortality, at least in the US. This has led to the implementation of colorectal cancer screening programs in multiple European countries, most of which employ fecal occult blood testing using the fecal immunochemical test, or the FIT. National population-based screening was implemented in Denmark in 2014, and citizens between 50 and 74 years of age are invited. The number of patients receiving antithrombotic treatments is increasing, especially among those eligible for colorectal cancer screening. So we wanted to evaluate the effect of different treatment regimens on the national FIT-based colorectal cancer screening program. It is important to know the effect of antithrombotic treatment because if treatment leads to a substantial decrease in FIT positive predictive value, the screening program would potentially lead to an increased number of unnecessary colonoscopies among patients receiving these agents. The patients would be subject to a risk of bleeding and a risk of perforation, along with an increased workload for the regional endoscopy units without the necessary benefits. We did a register-based study using Danish registers, including the Danish colorectal cancer screening database, and we used data from 2014 until 2016. From the data, we can see that any treatment led to a 40% increase in the number of FIT positives, regardless of age, sex, and comorbidities, with nonvitamin K oral anticoagulants leading to a more than twofold increase in the number of positives. The positive predictive value was also affected by any treatment, especially treatment with NOACs led to a reduction in positive predictive value by 42%. However, when analyzing the total population of participants, roughly 550,000 people, we found that there was an increase in at least high-risk adenomas among this population. This might imply that at least some of the antithrombotic treatment regimens might at least demask some high-risk adenomas. So what are the next steps? We need to evaluate if the lesions detected in patients receiving antithrombotic treatments are different from those detected in other participants to increase our knowledge on which lesions might be demasked by antithrombotic treatment agents. Moreover, individualized cut points according to antithrombotic treatment would be preferred to avoid unnecessary colonoscopies. However, to make any such recommendations, the cohort must be followed over time to identify those with a negative FIT who develop colorectal cancer after the first screening round. This information may help to inform patients about the changed risk-benefit ratio, that you are at a decreased risk for at least colorectal cancer. However, we might actually find more high-risk adenomas among those who participate in screening. And on these data, we cannot make any recommendations as to a discontinuation of antithrombotic treatment in relation to colorectal cancer screening. Thank you.